Okay, so I'm going to be summarizing what I think were the most important key points from the very first lecture, which is over the superficial back muscles. Sorry, superficial, deep, and suboccipital back muscles. Okay, so what I thought the four key points of this lecture were to be able to differentiate between intrinsic and extrinsic back muscles. So just in general, how they're categorized, what it means, how they're innervated, all that stuff, what they do. Then he broke down the extrinsic back muscles by layer and similarly the intrinsic ones, and he kind of grouped them together. So I tried to follow those groupings. And then he talked briefly about the suboccipital muscles. So, in understanding intrinsic versus extrinsic back muscles, the way that I think about it is that the extrinsic back muscles are extra. And by that, I don't mean that they're unnecessary, but just that they're not really part of the back. So, when I think about the extrinsic back muscles, I imagine like a dog or a cat or an animal that walks around on all fours, and all of the muscles that are pertaining to the upper limb, so for us our arms, but for them it would be just another one of their legs, those muscles that regulate, the upper limb, the scapula, the humerus, all of that, they're located on the back, but they don't technically really do anything for the back as much as they do deal with that upper limb. So I think of those as being extrinsic or extra, and they do they don't do extension, right? They do all different things with the limb, but they're an extension of the upper limb. So again, extrinsic, extra, extension of the upper limb. So because an animal walking on all fours, their upper limb would be to the front of them, as opposed to like to the back of them. I think of the in front of them being the ventral portion. So the ventral rami are going to innervate those extrinsic, extra arm muscles that are technically arm muscles that are just located on the back, if that makes sense. So that's the way that I remember that the extrinsic back muscles are going to be the ones that are dealing with the upper limb, as well as the fact that they're innervated by the ventral rami. Okay, and this is in contrast to the intrinsic back muscles. These are what you would think of as the actual back muscles. Those are going to be doing your posture. They're going to be doing your turning side to side and all the other things that deal with your back and your spinal cord. And because these are your true quote unquote actual back muscles, they are being dealt with the dorsal rami, right? So if you had a dorsal fin, like a dolphin or something, it would be on your back. Dorsal rami do the intrinsic back muscles. So that's the first major thing. Next, he went and broke it down, and he starts from the outermost side. So I did that as well. So going from extrinsic, again, those are going to be the quote unquote extra ones that deal with the arm. I grouped them by, I have the trapezius and latissimus dorsi. Both of these, I grouped them together because they really all deal with movement of the scapula. But I put these, really importantly, these ones together because they all share the same innervation and blood supply. Okay, so trapezius, he broke it down. He talked about, where it attaches and all that, and you need to know that. But the big picture about the trapezius is the fact that it can be broken down into 3 different parts, and that each of those parts have a different function. It's important to know the innervation and the blood supply of the trapezius, and that it's different from this group over here, the levator and the rhomboids. So the trapezius, that's the most external. It's going to be on the top, going from your neck down to connecting to the spinal cord and also the shoulder blades. And it has an ascending part, it has a middle part, and it has a descending part. And I'm not going to break those down because, again, that's just going to be something you have to memorize. But the important thing to know is that it is innervated by the spinal accessory nerve, and that the blood supply of the trapezius is the, oh, I should know that. I can't remember. I didn't memorize that. Okay, and then the latissimus dorsi is the other weird one because it's on the bottom of the back, and it connects not only to the thoracolumnar fascia at the bottom as well as the pelvic girdle, but it also comes up in a little strip and attaches to the humerus. So you could see that this is one of those ones that it attaches a little bit to the bottom part of the scapula, so it does deal with the shoulder blade a little bit, but it also is really important for movement of the arm. Okay, so that's these two muscles, and again, it's one of those things that you just kind of, Anki it, memorize the function and the innervation and stuff. So the reason I grouped these ones together, the levator scapula, the rhomboids, is because they share the same blood supply, they share the same innervation, and they essentially have the same function. So they are innervated by the dorsal scapular nerve, which comes from the brachial plexus. They are their blood supply comes from the dorsal scapular artery, and they deal with basically lifting the scapula. That's the main thing, lifting and retraction of the scapula. So yeah, that's why I put those ones together. And again, you are going to need to know like the attachments and stuff like that, but that's just kind of memorize that. But big picture, it's easier to think of them in a group. And then the last group of those extra muscles is going to be the serratus posterior, which has the superior and inferior. And both of these function, they move the ribs. So they are another extra. So they don't actually move the upper limb, but they're extra in that they contribute to breathing. So the serratus posterior superior is going to be important for breathing in, and the serratus posterior inferior is going to be important for breathing out. Okay, and this is just showing all those muscles. So you can see the outermost layer here. So this one shows the trapezius, and you can see the ascending ones and the middle ones and the descending ones, and they all focus on the movement of the scapula and upper arm. The latissimus dorsi, which again, attaching at the thoracolumnar fascia, attaching at the lower edge of the scapula, and then coming around and it inserts on the groove of the humerus. Okay, so it's important for movement of the humerus as well as movement of the scapula. Then when you take off those layers, you can see the rhomboids. So this is the rhomboid minor, rhomboid major, and the levator scapula. And remember, we're going to group those together because they all have the same innervation and blood supply, which is the dorsal scapular nerve and the dorsal scapular artery. And they all have essentially the same function, which is lifting of the scapula and then retraction of the scapula, which is what the rhomboids do. Okay, moving on to the second group. Now we're going into the true quote-unquote back muscles, and all of these are going to be dealing with the movement of the spine as well as turning of it. So the outermost group is the splenius, which has the splenius capitis and the splenius cervicis. Splenius, Dr. Hinojosa clarified it means band-aid, and it looks kind of like a bandage. And these are called the spinotransversalis. And the reason why they're called the spinotransversalis is you can see that they go from the spinous processes over here to the transverse processes higher up. And the two important things to know about these muscles is that they're in the same plane. So the muscle fibers are all going in the same direction. And that contraction so when they contract bilaterally, all of these are going to extend, right? So you can, if they pulled back at the same time, it would pull the neck back. But the important thing here is that when one of them contracts, so on one side, they're going to move to that same side. So it's contraction to the ipsilateral side, which is pretty standard. But you'll see later that there's one group that pulls to the contralateral side, and that's the one that you need to remember. Okay, so splenius, band-aid, same plane, moving to the same side when they contract. The next group is the erector spinae muscles. oh, sorry, I didn't say this. All of the intrinsic groups, because they are those deep back muscles, they don't have special names for the nerves. All you need to know is that every single one of the intrinsic back muscles is innervated by the dorsal rami of the spinal nerves. I didn't say this, but the serratus posterior and superior and inferior, those, because they're between the ribs, they're innervated by the intercostal, which means the in between the ribs. And that's going to be the intercostal nerves and arteries. Okay, sorry, this is my first video, so cut me some slack. Okay, so the second group is the erector spinae muscles. We use the acronym I love spaghetti to remember the names of these in order, and it's going from the most lateral to the most medial. So I love spaghetti stands for iliocostalis, longissimus, and then the spinalis. And if you ever get confused, like, oh, is the iliocostalis the outermost one or the innermost one? I remember that the spinalis is on the spine. Okay, so iliocostalis, longissimus, spinalis. These are going to be really your postural muscles. They're all, again, innervated by the dorsal rami. And just like the splenius, capitis, and cervicis, when these contract unilaterally, they're going to the same side again. Okay, so ipsilateral side. The last group of the deep back muscles that he talked about were the transversospinalis. And all of them, what's unique, why they're called transversospinalis, is because they all go from the transverse process of one vertebrae to the spinous process. So you can see transverse to spinous, transverse to spinous, transverse to spinous, with the exception of the semispinalis, which is semi because it partially attaches to the spine and it partially attaches to the skull. So you have like the semispinalis going from the skull down to the spine. So the semispinalis is the weird one. So I remember the semispinalis is semi-weird. And that's because unlike the other things that we've seen, so the splenius capitis and the erector spinae muscles, this one doesn't contract to the same side, but when you contract these unilaterally, they go to the opposite side. So they go to the contralateral side. Okay, so that's the important thing to remember here. Semispinalis is semi-weird. The other important thing to remember here is that they're more developed in different regions. So, for example, you need to know that the multifidus is most developed in the lumbar region and the rotatorus are most developed in the thoracic region. Okay, so those are the big picture things that you need to know about the transversospinalis. The semispinalis is semi-weird because it goes to the contralateral side, and then know where they're more developed. Okay, the last region is the suboccipital region, and he talked a little bit about the suboccipital triangle, and the important thing to remember is that this one right here, which is the rectus capitis posterior minor, is the only one that's not part of this little triangle here, the suboccipital triangle. How I remember these is I think of the fact that rectus means in a straight line. So you have your rectus capitis posterior. Okay, so rectus being in a straight line, kind of like more so straight up and down. Capitis because it's attaching to the skull. And then it's posterior because it's in the back, and then this one's minor because it's the small one. So then the other one, these two are related because they're both more straight up and down, if you could see that, right? They go in a straight line. So this is the rectus capitis posterior minor, and then this one here is the rectus capitis posterior major. And then the other thing that you need to remember about these is the obliquus capitis. Oblique means to the side, and so they both go more to the side, and they're attaching to, so both of the obliquus muscles are attaching to the transverse process of the atlas. Yes, the atlas. So they go, I think of it as kind of doing a split So this one's doing a split from C2 to C1, and then this one's doing a split from that same point. So the obliquous ones, where one ends, the next one begins. And he's going from the transverse process of that C1 to the skull. Okay, so I remember that. He talks a little bit about this common union point, that a lot of things attach to the spinous process of C2. But the most important things here is that rectus is straight up and down, so these are your rectus, and the obliquus are off to the side, so these are your obliquus capitis muscles. And then remembering that this is the one, rectus, capitis, posterior minor, that's not part of the suboccipital triangle. And then he talked about the innervation and blood supply for these ones. And so it kind of makes sense because they're on the vertebrae that they would be innervated by the vertebral artery. And then they're also in the occipital region, so the occipital artery. Okay, so that's what you really need to know about the suboccipital muscles. And then the only clinical correlation that was really in this lecture was damage to the spinal accessory nerve. So remember, the spinal accessory nerve innervates the trapezius. And so if you damage that, you can't shrug your shoulder on that side. So this shoulder drop is what it's called, is from damage to the spinal accessory nerve. And this is going to be important because we'll see in one of the next lectures that there's something called a winged scapula, and they like to tease apart the difference between this shoulder drop, which is spinal accessory nerve, versus winged scapula, which is from the long thoracic nerve, which innervates the serratus anterior. So shoulder drop, spinal accessory nerve. You'll see this a lot when patients have surgery, like I think he talked about like facial surgery, like a facelift. I can't remember exactly what surgery, but surgery will damage it. And they contrast it to winged scapula, which is, again, where it would be going up instead of going down. So here he's trying to shrug his shoulders and he can't. Okay, so that's what I think are the most important things from lecture number 1.